I'm Dana Gasparini, and welcome to this segment of Penn Voice. I am joined today by Pernille Gutschick, who is the Clinical Services Manager for the Behavioral Health and Recovery Services of San Mateo County. That's a long one.
Yes.
Pernille, welcome.
Thank you very much.
So we've had folks from Behavioral Health and Recovery Services before on this program, and I'm always so fascinated to know how many of the different kind of programs that you touch and the people that you touch in San Mateo County. And today we're going to talk a little bit in general about behavioral health and recovery services that you provide as a department. So talk about that, and then we're going to dig deeper into a few of your specific programs.
We serve all of San Mateo County's population in terms of from birth through aging services. So we have programs that deal with infants and pregnant moms, all the way to senior citizen services in their homes and everything in between. We also have various levels of services for people that need a little bit of support to people that need quite a bit of support in their home in order to be successful living independently in the community.
Now you're a clinical manager, so what are the kinds of services that you're providing to this very broad range of individuals?
We provide therapeutic services, mental health services, and medication to assist people, and also substance use disorder services. And that can be both outpatient and residential, both of those, in terms of levels of service. So we provide, when we say behavioral and recovery, we believe that it is possible to recover. And we're talking about behavioral health versus the old terms of mental health and drug and alcohol services. So we blended those two departments many years ago because we need to treat the whole person wherever they're coming from and whatever concerns and issues they have.
So, and correct me if I'm wrong, but I think I remember learning from a past segment that if someone is at home and they're viewing this program today and they either think that they themselves may have something that they would like help with, or they've noticed that of a family, neighbor, loved one, they can simply call your department, your hotline, and begin to get help. It's not something that they'd have to see a physician to get a prescription for or anything. If someone thinks that they may need some type of support in this behavioral health or recovery, they can call you directly and get help.
Yes, they can call our access line. They can also go online to our website, Behavioral Health and Recovery Services, under the county website. And there's lots of resources there, and sort of guidance of what kind of services we provide and how to get in touch with the providers.
And I think that's really important for us to make sure our viewers know that if we ever see someone in our lives that we think may need help, let's not assume they're either getting it or they wouldn't want it. We can jump on your website and really educate ourselves to see if, in fact, there would be a way to outreach to that individual and help them.
Yeah.
Today we're going to talk specifically about what you do in partnership with law enforcement. So tell us a little bit about the kinds of services that you help in partnership with law enforcement.
So it's sort of a broader term. I'll try to describe that first, which is we have services for people who are beginning to go into crisis that are more of the preventative nature, all the way to when somebody is in full-blown crisis. What do we do then?
Okay.
And law enforcement is an intricate part of our whole community that we work with. So some of the things that we do is we do crisis intervention training for law enforcement, and also the San Mateo Assessment Referral Team SMART. They're medics, so that they have a lot of skills and resources in the community when they are responding to somebody in crisis or potential crisis.
Right, because typically if someone is in crisis, there's a 911 call, and the Sheriff's Department, police departments, ambulances are usually those first responders.
Right.
And if it is a behavioral health issue or a substance abuse issue, there are some ways in which you want to deal with that individual and help de-escalate the situation. And those are the tools that you're giving to law enforcement.
Yeah. So crisis intervention training is, if you want to use the old-fashioned terms, it's other tools in their tool bag.
Right.
They have all their training that they need to follow and their procedures they need to follow. But when they see somebody in crisis, they can better recognize what might be going on for that person,
Right.
so that they can interact with the person in a more de-escalating way and get that person to the services that they need. They do not always need to go to the hospital. We have crisis residential services called Serenity House, where
Right.
people can go to. And also they can go to a detox station if that's what is needed for the time being, or simply they can be returned to their home. They might have wandered away and so forth and been discombobulated and so forth,
Right.
so that they can go back home again, that they don't need to get further escalated by going to the hospital, which some people are scared of.
Right.
And scared of going into ambulances and so forth. And that's where the SMART team can be dispatched by police also, and they can take them anywhere they need to go.
And then have you gotten any feedback? I mean, so I would imagine that this is one of the ways in which we stop incarcerating people who really shouldn't be incarcerated. They just needed services in order to either help prevent their behavior or get help in understanding their medications. As you said, a lot of it is medication deployment. So have you seen any response and any data that tells us that, you know, these are the really critical tools for our community?
Yeah. Crisis intervention is on a national level and even international level, and there are statistics that it works.
Right.
And there is a huge buy-in throughout the nation for this kind of training. It used to be up to various police departments whether they kind of bought into it and sent their officers for training. It has now become law in California where they must have this training, both in the academy and also follow-up training, and then annual and biannual trainings from there on.
So again, we're going back to the person who's seeking services. What are the other kinds of programs that you provide that maybe someone today might say, gosh, I didn't know that was in existence for me?
Okay. We have a very close collaboration with the National Alliance for the Mentally Ill, NAMI, and the Sheriff's Office in providing the crisis intervention service. But also what they learn is that you can have family members or the individual call NAMI for support more on a peer-to-peer level, or as a family member that really understands what this family member might be going through. So that's another level of support, and also community-based organizations in addition to behavioral health. We're not the only service.
Right.
There's many different community agencies. And what we will help people with is, if they have private insurance, where to go and who to talk to and how to navigate that system. They will get support in that also.
I think one of the things I learned previously as well is that it is the go-to place to call.
Yeah.
Right? So even if you don't provide the services, you have resources in which you can direct that individual in any point in their journey. So it's not just crisis, it's not just in identification, that you have resources all throughout their journey and anything that might be able to support their well-being.
And we have a 24/7 crisis line that anybody can call at any time to kind of talk it through when nobody else is open at 3 a.m. in the morning.
Right.
That they can get that kind of support for the time being, and they can also talk to them about various services in the community so that they're referring them on also. And that's what we're really trying to do. Is we had a lot of standalone services, and I was very excited to have the position of more recently to kind of develop a continuum of services. So it's not like you go here, but then where do you go from there?
Right.
So we're trying to do the warm handoffs so that people don't get stabilized and then what now?
Right. And you've lost them in the system, so to speak.
Right.
You know where they are.
Yeah.
So would you say that's sort of your overarching goal for behavioral health and services?
Yes.
Is to make sure that someone who contacts you is then tracked and followed throughout your program.
Yeah.
We're just now ending our program, but I want to make sure that people know the website and where that you had mentioned the call line. We'll put that up at the end of the program. Website and call line, I think, is the two places for people to go for information.
And we have a whole page that's filled with crisis services under behavioral health and recovery services under health.
Okay, on the San Mateo County
So
website.
we have them all listed together, so it'll be very easy for people
Okay.
to get to those.
Well, Pernille, thank you so much for bringing us a little bit more information about all that you do within the San Mateo County Behavioral Health and Recovery Services Department. Thank you for what you do personally as well.
Thank you.
And we'll see all of you next time on Penn Voice.